Well, good afternoon. I'm Ed Ullman, pharmacist on the mountaintop in Tannersville, New York. Well, it's hard to believe, and we're going to talk today about the coronavirus. It's only been 5 weeks since we recorded the first coronavirus infection in New York State. 5 weeks. Now the whole world has been locked down, and New York State has become the epicenter of the United States, one of the epicenters of the world, and 50% of all the deaths have now occurred within the New York City metropolitan area. In the past weeks, these past 5 weeks, 11% of the United States workforce has been lost. A record $2 trillion stimulus package has been signed into law to help stabilize the economy, and as Pope Francis said, the integrity and decency of us as human beings is now being tested. Worldwide, we had 1.9 million cases of the coronavirus that has been reported, and with a death or fatality rate of 6.6%. Italy, like we've been watching, has been hard hit, but now Great Britain and Spain are right up there also, and their fatality rates are running between 10 and 13%. There's a curtailing down, but it's a pretty ugly experience in that part of the world. In the United States, we now have over 607,000 reported positive cases, and our fatality rate is 4.3%. Now this is up from 1.4% just 2 weeks ago. In New York State, we had over 203 reported positive cases, and we have a growing fatality rate of 5.4%, which is up from 1% just 2 weeks ago. So how many of the experts had been predicting about this wave that we were going to see in New York City? Well, we saw it. And it was just heartbreaking to have a report of 700-800 people, New Yorkers, dying every day. But that was a reality that we watched, and that was just 2 weeks ago. In Greene County, it's good news. We've had 80 confirmed positive cases. We have 7 people in the hospital, and we have 131 individuals that are being self-monitored for possible exposure. But we've had no fatalities in Greene County, and that is something to be very happy about. On the positive, Governor Cuomo now reports that the worst may be over, with decreasing hospitalizations, increased testing, help from the federal government, better coordination with neighboring states, which I'm very happy to see, and a healthcare workforce that just refuses to quit. The curve is flattening, but the governor also made it clear that we must be smart. We must be vigilant. We must continue to practice our conventional wisdom for prevention, like cleaning our hands. We know we've heard it. Please continue. We need to continue to practice social distancing, and we've got to be kind to each other. We simply cannot afford a rebound from this virus or any new national spikes, or it will be devastating. Premature openings could lose all the efforts and the sacrifices that we, as a community, as a nation, as a world, have made to date. We're going to be smart again. We must listen to the experts and be prepared for an 18-month rollback that could still provide waves of flare-ups and hot spots like nursing homes, but that we'll start to see that we're getting back in control of the situation. And I'm very hopeful that the rollbacks will start to begin towards the end of May. That would allow us to start to go forward into a positive direction. But let's be smart. The coronavirus remains a work in progress. Every day something new is discovered that is about its characteristics or its treatment options. Experts are looking very closely at mass testing techniques that have been very successful in Taiwan, especially where they can identify the individuals who are testing positive, identify who they've been exposed to, and then they do by what's called contact tracing. Go and contact every one of those individuals to make sure that they self-isolate. And everything is monitored through technology. Everything, and it's working really quite well. We continue to look at therapeutics or drug therapy that could be approved by the FDA and will be hopefully effective, especially for our chronic illness patients that are getting the disease. But as of right now, we still have nothing that has been proven. And we continue to develop for a vaccine. This week, I've had a number of our patients come in and ask me some questions, and ask me if I would just kind of report on it. So here goes. The first question that they had was, what's the difference between the coronavirus and COVID-19? Excuse me. And if we can look at it in a simple terms, just like the influenza is a virus. It has subsets, and each year we don't quite know which mutation will occur, but we'll then have different types of influenza. The coronavirus is the same thing. It is a class of viruses, and the Ebola virus, which is another one. And then we named this one the COVID-19 because it came out in the year 2019. So it's kind of a subset from the larger family of coronaviruses. I was also asked, why is it that the coronavirus is more dangerous than the annual flu? And I think it was a great question, because if you look at the annual flu, every year we lose about 30 to 60,000 Americans. That's a big swing, it's a big number. But understand that we are losing that much when so many individuals for public health purposes are being vaccinated. So even though the vaccinations might only have a 50% success rate on an annual basis, it's still helping us to avoid an epidemic. Now, with the influenza, understand that will impact us. We'll start to have symptoms within 2 or 3 days, and then we'll have the symptoms for about 10 days, and then it leaves. But we are really only contagious during a very short period of time of maybe about 3 days. With the coronavirus, it's a very different animal. And we know that we can be infected, and we can continue to infect individuals for up to 2 weeks. So the coronavirus is much more dangerous to take. And even though we are only hoping now and anticipate that we will have flatten out at about 60,000 lost lives in America, not too different from the high end of the bad years for influenza. If we did not do social distancing, and with the way that this virus operates, the virus can get in through our eyes. It can get through our masks. We know, we've already talked about how many people who are infected, but they don't show any symptoms. That this virus just has too many opportunities to spread quickly and put us into a serious epidemic that we might never be able to recover from, or take us for years like the plague did in 1919. So that is why this social distancing has been so important, and why there's a difference between the normal influenza and the coronavirus. I also was asked to say, how come kids are being spared from the coronavirus? And it's a great question. Again, the virus is a lot that we don't know. We are still just trying of understanding it. But what we are knowing, are watching, is that the coronavirus has this ability to go in and to shift down into the cells in our lungs. We'll call it our respiratory system. and that makes it very, very dangerous. And what we're finding is that when somebody is infected with the virus, their immune system can go into overdrive. And when the immune system can go into overdrive, it can then go do more damage to the lung area, and that's why you have watched individuals that have had compromising immune systems or COPD, that they go downhill very fast, even when they're put on to a ventilator. So what we're discovering is that children, on the other hand, do not have mature immune systems. The immune system is still developing and does not appear to be as accelerated as we're seeing with adult immune systems from the coronavirus. Well, I also was asked what about the testing of antibodies and what we're hearing out there of what's hopeful. We have already put in an order to be able to see if we can get testing and if we can get approval from the health department. And these tests are going to be able to allow us to just take a simple blood sample from a patient and to use a few chemicals and to be able to come back and say, yes, you have the antibodies in your system, which means that you have had the coronavirus in some shape or form. We don't know how, when. There's going to probably be other testings where we can test the saliva, but that's a general concept. And the concept is saying that if your body says you have antibodies, that means you can go back to work. That means that hopefully you have protection against future breakouts during this particular type of coronavirus. What we don't know, and some of the experts are saying that don't get too wound up, that the number of individuals who are testing positive for antibodies might be lower than we anticipated, but time will only tell. The other testing is that individuals who have had the coronavirus for at least 2 weeks have developed antibodies within their system. Can we extract plasma and that will have the antibodies out from that individual so that that individual could give it to another individual so that who could be maybe more compromised, that would allow them to have the antibodies in their system. So those are the two things that we're looking at that could be promising with antibodies. We're going to have to continue to fight this epidemic, as we always know. We continue to try to advise our patients that you have to have a strong immune system, and you have got to follow hydration. You've got to continue with stress management the best that you can. You have to have exercise, proper rest, which is extremely important, because remember, when we are sleeping, our body is working overtime. This is how we detox ourselves. This is the way that our hormones and our enzymes are being released by our organs. It's while we sleep. And so if we want to have a stronger immune system, we've got to be well rested. And we continue to recommend that you take supplements. Mushroom tincture remains high on our list. Elderberry tonic, the quercetin, echinacea, vitamin C, vitamin D, and zinc. The next few weeks and months will continue to be very challenging for us. And hopefully the supply chains will open and that we'll learn about what went wrong and what we can do to prevent this in the future. Folks will start to receive checks to keep just daily living. Businesses will find a way to hang in there and hopefully have opportunities and strategies to get back into the American economy. And trust me, as a small business owner in America and an essential healthcare worker, my team and I are being tested daily. And I can tell you that our testing that we're feeling is nothing compared to the health professionals that we see on the front line of this epidemic. And these are the heroes that are the glue that is giving us this inspiration that damn, we can do this. We're going to get through it. I want to just thank everyone here at Wellness RX for what they've been doing to help, to thanking us for being there, being open in the community, to being accessible, to answering their questions. I want to thank my volunteers that have come. Even this morning, another family called up and said, how can I help? They are here on the line helping us. They're making deliveries for us. And they're doing it from love and out of their heart. And I thank them. I thank our community members that have made masks for people that I can give out to individuals. And I especially want to thank all the folks who have made donations to our Patient Assistance Fund. Now, this is really, really important for me. This is something I want to be able to do. Our core mission at Wellness RX is to be of service to individuals. Well, there's no better time than now. I can't do it alone, but with a little help from our community, I can wisely use those donations to help individuals. On another video, I'm going to start to share stories with you on how we're helping you and our neighbors and everyone that we can. God bless everyone, and it's an honor to be here to serve.